Hi Juan, I'm here. I'm Nurse Bailey. I'm gonna go ahead and get your discharge paperwork and all the things going with you. Okay, so we can get you up and out of here. Essentially, you came in because you're feeling some palpitations, and we took an EKG. It showed a picture of your heart, and it showed us that you were in a funky rhythm called atrial fibrillation. And that's when the top chambers of your heart are beating fast and irregular, and that can cause blood pooling, which can cause clots and heart attack. So because of that, we put you on a medication while you were here called cardizem. That medication is a calcium channel blocker. We use it to help control your heart rate and slow it down. And this kind of knocked you out of the AFib and into a more regular rhythm. AFib does not go away on its own. You usually need to take medication for the rest of your life to help control this, and also medication to prevent strokes or heart attacks. So because of that, we're gonna go and we're sending you home with 2 new medications. Now I know because of your hypertension, you are already taking lisinopril at home. We're gonna want you to continue taking that as you already were. No adjustments were made to that, so just continue taking that how you already were. I'm gonna go over the 2 that we're sending you home with today that are new. You're going home with cardizem 60 milligrams once every day by mouth. We want you to take it the same as you always do. Don't skip a dose, don't stop suddenly, okay? If you forget to take a dose, we want you to take it as soon as you remember, but not too close to the next day dose, okay? Side effects you can look out for with cardizem: dizziness, headache, fatigue, super slow heart rate under 60 beats per minute, shortness of breath, swelling, or weight gain. We want you to call your provider, okay? Do not take cardizem with grapefruit juice. It can increase the effects of cardizem and actually cause you to have a lower blood pressure or a little bit more issues because it's making it go quicker, metabolize quicker. We want you to change positions slowly, and that's with all of these medications that we're giving you, because they all affect your heart rate, and your blood pressure. So just change positions slowly so that way you don't pass out or fall over, okay? The other medication that we're sending you home with is called Coumadin. This is typically known as a blood thinner, okay? This is what we want you to take every day, 2 milligrams once, just once a day, 2 milligrams, okay? This is to help prevent your blood clot from forming. If that were to happen, this is the medication that's going to help. Because we're putting you on this medication, we would like you to follow up with labs in 3 days so that they can check your blood levels and make sure you're in the range that we want you in. We don't want you to eat excess leafy green vegetables. If you're already eating them in moderation, that's fine, but they contain vitamin K, and that can actually reverse the effects of the blood thinner. So don't start to take it in excess, okay? If you miss a dose of Coumadin, give your provider a call. They will tell you how they want you to proceed with that. What else do we have for you, Juan? Okay, with the blood pressure medications you're taking, the lisinopril and the cardizem, and also because you're taking that blood thinner, we want you to avoid aspirin or NSAIDs like ibuprofen, okay? Also avoid taking herbal supplements like garlic, ginkgo, ginseng, and St. John's wort. Don't take any of those because they can also interact with the heart medications. Some things you want to remember when you're at home: use a soft toothbrush, soft bristle toothbrush, okay? And an electric razor. This is going to reduce your risk of bleeding. If you notice you have any uncontrolled bleeding or a nosebleed that goes longer than 15 minutes, we want you to call your provider. Other big red flags: blood in your urine, vomiting that looks like coffee ground emesis, stools that are bloody or tar-like, or if you have any signs of slurred speech, severe headache, dizziness, or weakness, we need you to call your provider, okay? Please avoid high-risk activities, and if you fall and hit your head, you need to come to the emergency room even if you feel okay. Let them know you've fallen and you're on a blood thinner. Do not drive yourself. Have somebody drive you. If you're experiencing big symptoms after a fall, call 911, okay? With all of these heart medications, we need to stress the importance of alcohol cessation or stopping intake of alcohol or recreational drugs, okay? I have given you some resources on the back of your discharge paperwork that is going to give you resources in the area that you can call or go to kind of help with those and help kind of get a handle on it if that's what you need, okay? But we want you to know that you need to stop drinking alcohol and using recreational drugs. It can interfere with the medication and cause big side effects, okay? We need you to follow up with your with cardiology in 3 days. I have attached on the back of your discharge paperwork the information for that appointment and the date and time. We already set it up for you, so you just gotta go, okay? It's really important that you go see your cardiologist in 3 days so that they can monitor your blood pressure and your heart rate, kind of see where you're at with those lab levels that you get drawn, and see if they need to make any adjustments to the new medications. AFib's a long-term condition and we need to monitor it closely, okay? We also want you to follow what we call a heart healthy diet. This is going to be your hardest to probably adjust to, but take it slow, and I've got lots of resources on the back of your discharge paperwork that kind of give you the do's and don'ts. I'll just hit a couple big high notes. Fruits and vegetables are great. Whole grains are great. Lean protein, skinless chicken, healthy fats, low fat, and fat-free dairy. Those are what we want you eating most of. We want you to reduce the amount of sodium that you are taking every day, and that means limiting your salt intake. So really no fast food, no canned food, no frozen or ready meals, okay? Those all contain high sodium, and we need you under 2,300 grams of sodium per day, okay? Fried fatty foods are not great. We don't want you to eat it on this diet. Butter, no using that, healthy fats, like I said, like the olive oil, avocado oil, those are great. No pop. If you are going to drink pop, do unsweetened pop. Unsweetened tea is great. Lots of water. We want to stay hydrated. We also need you to limit your caffeine intake because caffeine is a stimulant and that can make your heart work harder. If you need help, like I said, we attached a quick heart healthy diet do and don't on the back of your discharge paperwork that you'll go home with today, okay? This is the big thing I want you to look out for though. Strokes and heart attacks. With a stroke, if you are experiencing facial droop, facial numbness, one side of the body numbness, slurred speech, confusion, trouble walking, trouble with your balance, call 911, okay? If you're experiencing sudden chest pain or pressure, sometimes it can feel like, acid reflux. It can go to your neck, your arm, your back. If you have shortness of breath, sweating, clammy, nausea, vomiting, lightheadedness, call 911, okay? Those are signs of a heart attack. We want you to get in. Time is muscle. And then you're also not up to date on your flu shot, so I'm going to go ahead and give you that today. It is very important to do a flu shot every year, as this can help you stay healthy and safe and out of the hospital, because the flu can make your heart work harder. Being in the hospital and already having heart issues, you don't want it to lead to bigger problems, so we give you this flu shot in your arm, and this can help prevent any issues from arising, and it keeps you out of the hospital, okay? So I'm going to give that to you here before we leave. I would clean for 30 seconds. I'm gonna go ahead and I'm gonna give this to you in your upper arm, okay? I would go ahead and clean his arm for 30 seconds. For the purpose of time, I'll just say it out loud. Okay. All right, you're gonna go ahead and feel a little poke, okay? All right. And that is it. Thank you, Juan.